Hi everyone, this is Jaya Rajimatai. I'm proud to say that I'm a nurse and I will always be proud to say it. Nursing is a noble profession in taking care of people from birth to death, being with them in their sorrows and happiness. This year of 2024, as part of Nurses Day celebration in May, I'll be joined by nurses working in a variety of environments, from the bedside to one of the highest level in the nursing profession. The purpose of these videos are to provide awareness about the nursing profession and the career advancement possibilities in the nursing profession. Nursing is a calling. It is a call that some people will recognize early in their life while someone will recognize later on. To start off the celebration of all the nurses around the world, let me start with one of the best one I know. At a young age, she dreamed of becoming an actress but gave up that dream to serve her country. She served in the military for 20 years, which is where she found her calling to become a nurse. She started to take care of the wounded and sick veterans just like Florence Nightingale, a lady with a lamp. This week, I'll be joined by a woman full of innovative thinking and dream for the present and future healthcare industry. She is a leader of one of the biggest healthcare organizations in the United States. I will be joined by Dr. Robinson. Yes, let us hear from Dr. Robinson about her achievements. Please come and join with us.
Hi, I'm Jaya Rajimatai, psychiatric nurse practitioner. Today we have Dr. Robinson with us. She is a proven, strong leader in healthcare industry, and she's a strong problem solver, and she's excellent in practicing her interpersonal skills in her daily practice. And actually, I choose to do it today because, as we all know, March was the National Women's History Month, and May is Nurses Day we celebrate. And as a nurses, most of the time we celebrate whole May as a nurses celebration. So actually, my plan is to do the whole May to interview some nurses from bedside to the leadership level. So when I was thinking about to choose someone, first of all, in my mind, Dr. Robinson came into my mind because I don't know whether you remember, like a long back, I was in a status of confusion to select while I was advancing my degree. I come and ask you, I want to advance my degree. So I don't know. When I was in nursing, bedside nursing, I like as a manager, I like everything we do: infection control, management. We are a dietitian. We are advocate for the patient. So it was very hard for me to choose one. So that time you told me that okay, nurse practitioner is the best one. So I can perform all these roles and I can take any position. So that's what, when I was thinking about, I was thinking Dr. Robinson is the best one to start with, the best strong leader. And actually, she is working as a chief nursing officer, and she's the one, when I can think about from nursing profession, she reach her the highest level in the nursing profession. And today we are going to hear from her journey, all the journey of her, from her. I hope she will tell us how she reached up to the highest level in her career. So I would like to hear something about from your time, while you are growing up, your childhood time. So how was it?
Well, first of all, thank you for the compliment. And so, growing up as a child, I grew up in Chicago, Illinois. My father was a pastor, so I was a preacher's kid, as they called it, PK. And growing up in the urban city, of course, there are a lot of things that kids can get into in the urban city. But being the daughter of a pastor, he kept a pretty strict and tight rein on us. So we weren't allowed to go too far. I did attend public school for elementary school and high school. Believe it or not, in Chicago, you attend the same school from kindergarten through eighth grade, and then you go to high school for 9 through 12. So in your lifetime, you essentially may attend two schools. You have all of the same friends. So at this point in my life, I still have my friends from elementary school
Okay.
and
That's
from
good.
high school. We, stayed in touch and continued to form those relationships. Now, believe it or not, I actually attended a performing arts high school. I thought I wanted to be an actress, right?
Oh.
That was back when the movie Fame came out. So it started out as a movie, and then it became like a sitcom, and they had Fame, and it was on for a couple of years. And I always imagined myself dancing or acting. So I actually wanted to be an actress. So I begged my parents, oh, please allow me to go to this performing arts high school. So it's the only performing arts high school in this city that was a public high school, Security High School in Chicago. I attended that, and I was actually a drama major and a chorus minor.
Okay.
So I acted and sang just a little bit. And probably around my junior year of high school, we would have a lot of military visiting the school, talking to us about careers in the military, as well as a lot of colleges coming, talking to us about college. The thing that intrigued me at the time the most about the military was their pitch about how you got to see the world. Being a young girl growing up in the city of Chicago, I had never really gone outside of Chicago except to visit my great-grandparents that lived in Mississippi. So that was it. It was Chicago and Mississippi. That was my level of travel experience at that time. So when the recruiters talked about traveling the world and having an opportunity to go to college while you're in the military and having the military pay for your education, I said, wow, that's just the best opportunity ever. So I went home and talked to my dad about it. Of course, my dad didn't like that idea. My mom didn't really like the idea, but my dad really didn't like it. It's like, well, I don't think a young lady should be in the military, because at that time, for some people, there were perceptions about women in the military and what might happen, what you would do, and things like that. So I had to convince him that it was going to be okay. My mom talked to him, a few of our other family members. Eventually, he agreed to it. They signed the paperwork because I actually graduated from high school at 17. So I had to have parental consent. I wasn't 18 years old yet. So they signed the paperwork, and off I went to boot camp, to military boot camp, the United States Navy. I went to boot camp in Orlando, Florida. And as you can imagine, growing up in Chicago, the winters were brutally cold. I remember going to school where the wind chill factor was minus 60, very cold. So I thoroughly enjoyed waking up in Orlando 4 o'clock in the morning, and it was already 80 degrees and humid. And I started out in the military as what they call an airman. And after I completed the airman school, which was about 8 weeks, I had a 99.9 average, and they said, hey, we think you would be great at this other school. And so it was called Radioman, which consisted of communications, setting up communication systems. And I said, oh, well, that sounds interesting. So then they sent me to San Diego, California for about 6 months to attend that school. So after San Diego, I was officially what's called a radioman. And I went off to, guess where my first duty station was? Naples, Italy.
Oh my God.
So I was 17
Uh,
in Naples, Italy.
Mm.
I had such a wonderful time.
Mm.
And all I knew is I enjoyed traveling, seeing the world, and everything that the military had taught me.
Mm.
I thought at that time that I would probably stay 4 years maybe and go back home. But I stayed in Italy for a few years. After that, I went to Norfolk, Virginia. I was on my first naval ship, the USS Puget Sound.
Okay.
There were a few thousand people on the ship, and I absolutely loved it. So on that particular ship, we did what's called a Mediterranean cruise, where you cruise around the Mediterranean. So I actually got to see all of Europe and many other places. And at that point, I stayed another 4 years. And before I knew it, I was already at the 10-year point. And people would always say, if you're going to get out of the military, you need to do it before that 10-year point. After 10 years, it's just like working for a company. You're vested and you need to stay in for the long haul. So after that 10-year point, I was actually stationed in Portsmouth, Virginia, at the Naval Hospital. And at the Naval Hospital, I was working there as a radioman doing communications.
Okay.
But they asked for volunteers. They were shorthanded up on some of the inpatient floors, and they said, we need anybody to kind of come up and help. And it was candy striper duties, but I said, hey, I'm working here in the hospital, go up there and help them. I met quite a few nurses, and they gravitated towards me. I really enjoyed being around them. So I was always on my off time up there being a candy striper. And one day I had an epiphany. I said, I want to do what those ladies are doing. They cared for active duty military with such professionalism and care, and they were so genuine about nursing, so passionate about it. And I'm saying, wow, that is a wonderful profession. I want to do that as well. Well, they told me about a program that the military had where they would send you to nursing school full time. After you completed nursing school, you would become commissioned as a naval officer. I applied for that program, but they're like, it's really competitive. Only a few people get selected each year, and sometimes people have to apply 5 and 6 times. And I said, well, I know who I serve. And so I applied for that program. I was selected the first time. I went to nursing school. I completed nursing school.
So where was that? The nursing school in
Virginia.
Virginia.
It was I went to Norfolk State University. They had one of the best nursing programs there at the time. Went to nursing school full time, but I was still considered on active duty. I was attached to the ROTC unit at the school. And once I completed my degree, I was commissioned as a naval officer, and I went to my first assignment as a registered nurse, and that was also in Virginia at Portsmouth Naval Hospital. That's where my career as a nurse began.
Oh my God! From where to where? From an actress to a nurse, actress to military, then to nursing.
Yes.
So, which all country Italy, Virginia, then rather than Italy, any other places outside of America?
So on the ship, when you do the 6-month cruise, I've gone to France, I've gone to Spain, I've gone to Rome. I've basically traveled all over Europe. I've gone to, I was in Saudi Arabia. For 2 months.
I have a friend also. He's working as a marine engineer.
Right.
Then I asked him, why you want to become a marine engineer? Then he said, yes, I want to see the world, so I can travel. So you got your opportunity to travel all over the world.
And then I was also stationed on the hospital ship. It's called your operational platform, and I was assigned to the USNS Comfort. That's actually a hospital ship. That was a wonderful experience because as wars are happening or humanitarian efforts are happening, they often send those hospital ships out. You may have seen them on the news. There's one on the East Coast and one on the West Coast.
So you meant the hospital ship?
Yes.
Oh, okay. Okay. So the hospital has a ship. It's only for the veterans?
It's a floating hospital. It's for military, and we take care of active duty people during wartime and otherwise.
Oh,
and so
okay.
it is
How the Florence Nightingale was doing with her. Okay.
Yeah, so that was a wonderful experience.
Okay.
As well. So within nursing, I had many different roles. You always start out in the military on a ward. They believe that you have to earn the right to do anything else. And they also believe that the foundation of nursing is always med-surg. As a new nurse, you were going to start out on med-surg. After you spent about 2 years on med-surg, they're like, okay, what would you like to do now? Where do you see yourself? At that time, I said, wow, I think I would love to work in the OR, right? But again, they said, well, that's a very competitive school and only a few people get it. So in the meantime, what would you like to do? So I worked on the surgical inpatient unit for a while. Also worked mother-baby, complicated OB, because in the military you do have the OB along with complicated obstetrics. I did that. And all of a sudden, I applied for OR school in the military, and I was accepted. I went to Camp Pendleton, California, for formal schooling. It was about a 4-month school back then. And after,
like a certification program to become an OR.
And you become an OR nurse. They teach you all of the fundamentals and all of that, and you go back to your duty station as an OR nurse. And that definitely was my love. Fell in love with the OR. I started out doing general surgery pediatrics.
Oh my God.
And so I was doing surgeries on these little babies. Oh, and that just broke my heart, but I loved it. And after that, I went on to other specialties like adult general surgery, ENT, orthopedics, neurosurgery. So I've kind of done the entire spectrum in perioperative. Now, the interesting thing about the military is you don't only work in the OR. So on certain days, you work in the OR, but you'll also work in the clinics that feed the OR. So meaning if
like outpatient clinic,
I would work in ENT clinic or the urology clinic. So the same patients that I saw in the clinic and serviced in the clinic were the same ones having surgery. So I may have done all of their preoperative things in the clinic, and then I was their nurse in the OR. So it was a true service line. That
it's
was
like
the
a
model.
continuum of care.
Yes, definitely a continuum of care. So I really did enjoy that. And also, we had to work in the recovery room sometimes. So I may have been on the other end recovering them after the surgery was complete. So my experience is very broad and wide. And what I've learned, when you have a broad base of experience, really you're flexible and you can do just about anything. So I've always believed that I could do anything. It just required a little bit of studying, a little bit of training, a little bit of
refreshment.
Absolutely.
And you were in the general surgery. So compared to that, what kind of surgery what you like the most?
My favorite was probably orthopedics.
Oh my God!
Because as a girl, I always played with dolls and I was very dainty and I liked to act and dance. Now all of a sudden there were these big power tools and instruments.
Yeah, that's what I like. When I was in the over amputation, I feel like it's a carpentry.
Yes, and so just all of the instrumentation and the machinery, I really enjoyed that. And so I think orthopedics and probably neurosurgery were two of my favorite services to work in.
Yeah.
Yes.
Yeah. Anyway, good to hear about all these things. Then, we are hearing a lot of things about, like, when someone come and ask me about joining in military. I don't have any deep knowledge about the military, how it operate here. But when someone come and ask me, I always says that, okay, complete your degree, then go to military. rather than is the I don't know is the right way to answer, but I'm thinking like when you go after high school, you have to start it with some lower grade, then it is
That is true. As
mm,
a 17-year-old, I started out as an E1.
mm,
That's the lowest grade
mm,
you could possibly be,
mm,
right?
mm.
But each time I went to a different school, I was promoted,
Mm.
and you can apply for schooling in the military. So the difference, and this is my opinion, the advantage of going to the military and allowing the military to send you to college is I've never had any debt for education. I have 5 degrees and I've never paid for one of them.
Okay. But is it like when you go to the younger age, is like people will be not treating you good, anything like that, any torturing? And
Personally, I've never experienced that. In the military, you have the enlisted ranks, and you have the officer ranks. Going in out of high school, obviously, you're going to be in the enlisted ranks, but they are the backbone of the military, right? They're the ones who actually make the work happen. Then you have the officer ranks. The officers are your future leaders. So they're grooming the most junior officer to become a senior leader. But even in the enlisted ranks, you're being groomed to be a senior enlisted leader. So you get the leadership in both facets. The only difference is the officer ranks can truly go to the top of the spectrum as it pertains to that formal leadership and command a ship, or command an entire fleet, if you will. So it's two different types of leadership, but enlisted people have very extremely strong leadership skills. In fact, companies seek out people who have been in the military because of the leadership skills they exude. With every rank that you earn, there's intensive leadership training that happens. So honestly, I wouldn't have done it any other way.
yeah. Anyway, it is good to know that, and I'm not much familiar about U.S. military.
It's a
and
great
really,
opportunity. And you get paid while you're doing it. So while you're in school and while you're learning, you're still taking home a very handsome salary.
Yeah, and another thing also, I do remember, I have patients coming with ADHD.
Yes.
They are telling, for last 5 years, I did not take any ADHD medication. I asked why. I was in the military, and it was very strict. So I don't need, I don't have any nothing. Everything is taken care of in military. Like, it's very strict. And I'm saying, like, I see veterans, so I see how they are structured. They do everything in structure, and they like to do everything as long as they can do. They like to do everything by themselves. They like to be independent always.
Absolutely.
That is a very good thing I noticed about when I compare to a veteran and a humanitarian patient. I'm seeing veterans are so empowered, they are so strong, they want to do everything by themselves as long as they can do. If they cannot, then only they see. Very good. I'm so lucky. I'm really proud of myself to listening all these stories and getting me this opportunity. And is can I hear a little more about your parents? I know that you said your father is a pastor, so I'm sure he is very proud of you now.
Yes, he was. So my father passed away a few years ago, but he was very proud of my accomplishments, and he would always tell everyone about what I did in the military and my path and everything. He was very, very proud of everything.
Okay. And your mom is alive now?
Yes, my mom is still alive. She's still living. She retired from the University of Illinois. She actually worked in the hospital system in the insurance section, like the patient administration section, for many years. And she was actually a local union steward.
Oh, okay.
SEIU, it's one of the largest unions in Chicago.
Oh, okay.
A union steward. And I have siblings, one each. I have an older brother, and he's also a pastor as well.
Oh, okay.
He currently pastors a church in Chicago. And I have a younger sister, who actually lives here in the Dallas-Fort Worth area.
Okay.
And I'm that poor, forgotten middle child.
Okay, you're the sandwich.
I'm the sandwich, so I'm that middle child.
So, what about your family?
And so for me, we have 3 children, twins that are 21. They're actually in college right now. One will be graduating in May, and the other twin will graduate next year. She actually attends the United States Military Academy at West Point.
Oh, okay.
Yes.
So she got it.
Yes, and the oldest one graduated from a university in Memphis. It's called Lemoyne Owen. She's a biology major, and she actually works in the laboratory at Parkland.
Oh, okay, good,
So
good.
she is a medical technologist.
Okay, so it's continuing. The military and the healthcare is continuing in the family. Okay,
Absolutely,
yeah.
they're continuing that tradition. And of course, my husband served 30 years in the military.
Ah, okay.
Yes, 30 years for him, 20 for me. So we are a
Military
military
family.
family. Now, my parents weren't military, but my grandfather served in World War II.
Oh, okay, okay. Oh, I forgot to ask. Did you exposed or attended any war?
Yes, I was actually in Desert Shield, Desert Storm, and then towards the latter part of my career, Operation Iraqi Freedom. I saw that, and then I was retiring.
Oh, okay. So you were in Iraq that time, or?
Yes.
Oh, okay. Yeah. Yeah. I think it was in 1992, something like that. Yeah. Okay. Okay. Yeah. Good to hear all the military stories. But you are the chief nursing officer, and you have gotten all these degrees, multiple masters and multiple bachelors. So I like to hear more about how you reach up the highest level, the position in your nursing.
Absolutely. When I originally started nursing, of course, in the military, you do a lot of leadership training. And people have always said I'm sort of a natural born leader. I've never really thought that about myself, but other people always saw that in me.
The leadership.
Yes. So when there was always a need for someone to do something as I was coming up through the military, I was always the one to do it. It was no different in nursing. I loved being a young nurse. I loved all of the knowledge that I received from the nurses that had been around for such a long time. So I knew that eventually I wanted more. So every time there was an opportunity for a promotion or a supervisory job or a management job, I was always the person that said, hey, I'll do it, no matter how difficult it was, especially when it was a challenging area. Most people would say, oh no, I don't want to go to that particular area. I only want to go to the area that runs like a well-oiled machine. It's very easy to want the area that runs like a well-oiled machine. But the way you show just how good you are and the skills you possess is in an area that needs some work. So I became known as the cleanup woman, meaning I would go into an area and just take those challenges head on and fix everything that I could fix and kind of turn things around. So that was always my goal, just to go into a place and ensure that it was much better when I finished than it was when I started. So that's always the goal, to make things better. And fortunately, I was able to advance. I came into my current role, right? My current career, should I say, life as a nurse outside of the military. I started out as a chief in sterile processing, infection prevention and control, which I really love. All things infection prevention and control. Sterile processing teaches you a lot because that particular department impacts everything in a hospital. It's an extremely important job they do, but people have always thought of them as merely being dishwashers. But that's a highly skilled job, and it teaches you a lot. You have a better appreciation for things that go on in a facility having done that.
Did you take any special courses for that?
Yes, when I went to school in the military for OR nursing, the sterile processing
was there?
is part of that,
Oh,
because in the military, those areas are part of the same service line, so they're not separated. If you manage the OR, you manage sterile processing. So I had lots of experience in sterile processing. After that, I went on to become the director for perioperative services, and I did that for several years. And after that, I became the deputy chief nursing officer and then the chief nursing officer. And with each level of growth, you have a different level of responsibility, a different level of accountability. It's not always easy because you acquire more and more team members that work along with you, right? So it can be challenging, but I would always say that the rewards are much greater than any challenge on any day. Nursing in itself is so rewarding when you can impact the lives of people, and not just people, but the lives of service people or people who have served. I mean, what greater opportunity and what greater honor could you possibly have? And then molding young nurses and young lives. What more could you ask for than to groom other nurses to become the future? Young nurses are our future, and I say that all the time. So it behooves us to coach, mentor, and grow our own, because after all, we're not going to work forever, and they're that next generation that we are depending on to carry the torch forward and to take care of our servicemen and women.
Yes, it's very good, very good. And you reach from the baseline of your career to the top level. So what you like, you did different roles in nursing and in military. So when you look back, or when you look at now, so what was your favorite?
Wow. People ask me that all the time, and picking a favorite is so hard because I'm one of those people that I like a lot of things. So I really enjoyed infection prevention and control because it's an entirely different concept. I really enjoyed that, and I also really enjoyed being at the bedside. Quite honestly, when I worked on the surgical units, that was so gratifying. Being able to actually see the entire continuum of care.
Especially surgery, like they're coming in with a pain or problems, then surgery, then they're getting better and going.
Absolutely. So for me, there's nothing greater than seeing someone when they initially come and then
coming with
them,
a cry, going with laughing and going.
Months later, and they're like a totally different person, and they always said thank you. That's gratifying.
And then what made you to take all these degrees, the multiple degrees, to reach up to the chief nursing officer? You don't need this many degrees.
Honestly, I have to keep myself busy. I was always one of those people wanting something to do, because in the military, everything is such a fast pace, and you get accustomed to moving at a fast pace. If there's not some crises or something to do, you're like, oh my goodness, I'm not doing enough. So you always feel like you need to do something else. I would always keep my mind occupied with school. My friends would say, oh, you're a professional student. You're always in school for something. You've been in school like for 15, 20 years. And I would always say it keeps my mind active, and you get to learn something else. I didn't need
Mm.
any of the degrees. I just wanted to obtain them because
And
I
learn
enjoy
more.
learning. I
Mhm.
feel that
Mm.
learning is a lifelong commitment.
Yes, yeah.
And while even today I'm not seeking any other degrees, I'm always going to conferences and seminars. I still love to learn.
Yeah, and education is
Always.
the power too.
It
you know,
is.
Yes,
It is.
yeah.
Yes.
And especially when you are in this position, it's education is that is the backbone for all of us. Especially
Yes.
when you are in the higher level, when you say something or when you do something, you should know. Yeah, a lot of interesting stories.
Yes.
So you said all the good things about your journey, and from an actress to reach up to here. But I like to hear some challenges. Is it okay to tell the audience about some of the challenges you faced to reach from the lower level to the highest level of your profession?
Well, I would say some of the challenges always are you have to, people feel that you need to prove yourself, especially since I was considered what others would consider young. I don't consider myself young, but I guess others consider
Yeah.
myself young. And there was this feeling that you needed to earn your salt, that you needed to have 30, 40 years experience before you could become a chief nursing officer. Because if you remember historically, they were very seasoned women.
Mm-hmm.
You didn't see a lot of younger CNOs. And that was a challenge because people simply thought that, well, you haven't been around long enough.
Mm-hmm.
It's not that you don't have the knowledge or you don't have the will, but you simply haven't been around long enough. So you feel that you have to prove yourself.
Yeah, because you don't have that much experience, and as a leader in this profession, so when you take that role as a leader, yes, people are looking at you, and she don't have that much experience. What she's going to do? Yeah, those kind of it's not only in nursing, that is happening in every field. So that was the challenges. Then like as we know, March was National Women's History Month.
Yeah.
So this year the Women's History Month, the theme is like diversity, equity, and inclusion. So like in 2024, they are celebrating throughout the year. For that Women's History Month. So we know that in women with any class, ethnic background, they given their great contribution to the nation, to build up the nation. Most of them are recordable, unrecordable. Then when we look at, like nowadays, when we look at women are equally or more important in any profession. When you look at, we are proven our eligibility and how strong we are taking equal responsibility as man. So what is your suggestion for the coming generation? A little girl going to school and she's looking forward to join in military. So what is your suggestion for that little girl?
Well, my suggestion is to never limit yourself. Never allow anyone to tell you what you can't be. You have the destiny to write your own story. And so your story should be the one that you desire. It should exude your goals and aspirations. And nobody has the right to tell you what you can't be. And as a young girl, if you can see it, you can be it.
Okay, yeah.
And that's what I would tell a young girl. Think about what you want to be. You see other women doing it, or maybe there's not another woman doing it. But guess what? You can be the first one.
Yeah, that is, you are opening my eyes, because my daughter, she want to do the public health in masters and doing major in epidemiology. And in my I never heard of it.
Yes.
I'm like, I don't know, is it good or bad? So I was so I was thinking about, am I giving her that right direction or not. So I was still debating myself, but now, yeah, let them choose. You know,
Yeah,
they
let
let
them
them get
choose.
educated and let them choose.
Because it's important to be passionate
Yes.
about what you do, whatever it is.
Okay, yeah.
Because sometimes we feel like we need to fight for a seat at the table. Well, I can't get this position because it's primarily male dominated. I can't get this position because women just don't do that. But we should never limit ourselves. We should never worry about having a seat at a table because we're the table. We create the table.
Okay.
And wherever we are, the table is.
Yes.
When we walk into a room, the table will shift towards you when you exude that positivity and that self-assurance that we can be absolutely anything we want to be. And that's what I would tell any little girl. That's what I've told the 3 little girls that we have, that you can be anything you want. There are no limits to your success.
Okay, yeah, that is very good. But at the same time, they need to use that time wisely.
Absolutely.
Yeah, and because I always tell that, you know, in life, either we all will get good time and bad time.
Absolutely.
It is you to decide. In your school time, if you want to enjoy, not to pay attention to your study, then later your life you are going to be struggle. But in school life, if you struggle and earn your degree, study, later you can enjoy.
It's about mindset. It's all about your mind and whether you perceive your glass as being half empty or half full. So mine is always half full versus half empty. And I choose to see the world that way. I choose to be positive as much as possible and not try to let the world or other people determine what I think or how I feel.
So suppose, you know, what is your suggestion for a little girl who is planning to go to nursing school?
Well, number one, I would definitely encourage her because nursing is the best profession in the world.
Yes.
We're the most trusted profession in the world.
Yeah.
And we've held that position for many years according to the Gallup poll. So what I would say is to go ahead and go to nursing school. We're about 1 million nurses short. We need nurses. We need to groom them and train them up. But what's important for a new nurse is to get that time at the bedside. Being at the bedside is where you really learn that strong foundation. We all know that you can't build a house without a foundation, without a strong foundation. What happens if you choose to build a house without a strong foundation? It's the same concept with nursing. You need that strong foundation. Once you get that strong foundation, the sky isn't the limit. There aren't any limits.
Okay.
Right? But it's very important to get that hands-on experience at the bedside and then progressively start to assume other roles, become a charge nurse, become an assistant manager if that role is available based on where you work, become a manager, and just continue to advance yourself if administration is a goal. Not every nurse desires to be an administrator. Not every nurse desires to be in leadership at all because sometimes it can feel like a thankless job. Right? So you have to be built for that. It has to be within you that's what you are really called to do. That's what you really want to do. But the great thing about nursing is there are so many facets of nursing. So there's something for everyone. That little young nurse is going to have to decide, do I want to remain at the bedside for 30 years? Because honestly, we need people at the bedside and you need that experience. So it's great, in my opinion, if a nurse says, I don't have any interest in administration. I love being at the bedside. And you have people that have been at the bedside for 10, 20, 30 years. You need that experience. There's nothing at all wrong with that. I think it's quite honorable, right? But then you have other people that may want to go on to become independent as a nurse practitioner, a CRNA. You have people that may strictly want to do home health. So there's so many
Mm.
facets of nursing that you could literally change jobs every 2 to 3 years, do something different, and never do the same thing twice. That's how diverse nursing is.
Yeah, that's what I was interested to. Like when I look at, like, you can see nurses
Yes.
as a nurse. Then we can see the nurse as a researcher. You
Yes.
can see they are working in the infection control, and a
Yes.
teacher, and a provider, and a manager, and a detective. So
Absolutely.
yeah,
So
it's
what
unlimited.
it's unlimited. So
Yeah.
what that really says is that as a nurse, we can do anything, because think about it. When we need to be, we can do supplies, we can do, you name it, we can do it, right?
Yes,
So
and even
we're
aesthetic
very
nursing
versatile.
now, the nurse is becoming a beautician.
Yes, beautician, you name it, we do it.
Yes.
I remember helping some of my elderly patients doing their hair, polishing their nails to make them feel good while they're hospitalized. So yes, we do the entire spectrum, and I think that's what's so gratifying about the field, is because you can do so many different things to help others, because we truly are civil servants.
And another thing also, nursing, it's a service, it's a call,
It's
but
a
I don't
calling.
think anybody can do no. It is a
No.
call.
It's
So
a
that's
calling.
what, before choosing nursing, you
Yes.
have to decide, you have to think about, is it the
Absolutely.
right one for me?
And I know sometimes people see the dollar signs,
Hmm.
but as a nurse, it should always come from within, from right
From
here, from the heart, that you have that genuine compassion to care for others. Because if you don't, it will surface sooner or later. You can tell, you know the difference, and you won't do it for very long if
Yes.
your heart isn't
Yes.
in
Yes.
the right place.
Yeah.
So
You don't do it, or they will kick you out.
so
Yeah.
it's definitely a calling.
Yes, it's a calling. And I'm so happy, and I'm so proud. I feel myself so proud to sit with you and do this. And because
Thank you.
I always, my dream to talk to someone who reaches the highest level in the nursing profession. And I was having different dreams. Then as I said in the beginning, and after reaching to as a becoming a nurse practitioner, so I feel like I like to take care of patients, teach them, and I like to learn about the diagnosis and the treatment, and do better better medication, better treatment.
Yeah.
I think after working as a nurse practitioner, now I figure out what I want to, what is my role. But in the beginning, I'm very grateful and thankful for you to give me the advice years back. When I come to you, you helped me to choose the right one. And yes, and and in the future also, if someone coming to me, I will also will be doing the same thing.
Pay it forward.
Yes, and we are the lifelong mentors.
Yes, we are.
And thank you very much. Thank you for your time.
Thank you. It's been a pleasure.
Yes,
And
and I hope all of you enjoy this video. There is a lot of kids comes and ask me questions about nursing. I hope Dr. Robinson, well explained about the nursing career and the opportunities, and how you can advance your career, and where you can reach the highest level in the career. She's the best example of reaching the highest level in nursing. And thank you very much. Thank you for watching this video. Thank you for your time, Dr. Robinson.
Thank you. It's been a pleasure.
Thank you.